Hello, ladies and gentlemen. Welcome, dear friends, to another episode of One Health JARC Academy radio channel. At kasama ko ngayon, pulang-pula. Happy Valentine's Day, Ma'am
Hindi
B.
naman Valentine's because I prepared my color blazer red because it's very
May
important for our
significance.
topic
Yes.
today.
Oh, fantastic. And the title that you probably saw already on the thumbnail is that what they didn't tell you about
HIV
testing.
testing.
And we have a magnificent guest. So I'll start the honors of introducing her.
Yes, please.
And you will see her later. Our guest today is a celebrated expert in HIV care and advocacy. Recognized for her contributions both nationally and internationally, she has been honored with the Outstanding Physician in Sexually Transmitted Infections award by the Philippine Society of Venereologists. Acknowledging her role in advancing STI organizational development and government service, her commitment was further celebrated with a plaque of appreciation from the National Treatment Hub Conference, recognizing her dedication for providing quality treatment and support for people living with HIV.
Among her notable achievements, she received prestigious Thomas Award for Government Service from the University of Santo Tomas Faculty of Medicine and Surgery. Additionally, she served as the chair for HIV management in the AIDS Society of the Philippines, promoting evidence-based approaches to HIV treatment and care. She is also dedicated in extending her role as a master trainer in HIV counseling and testing, empowering health professionals across the Philippines. Her research on high rates of tenofovir failure in the local HIV epidemic and innovative responses to the challenges of HIV-19 in HIV care have
COVID-19.
COVID-19. Challenges of
HIV care.
COVID-19 in HIV care have made a significant impact on healthcare practices and policies. Yan.
So without further ado, it is with great honor that we introduce to you our guest.
Dr. Rosario Jessica F. Tactacan-Abrenica.
Let's start this show. Welcome, dear friends, in this conversation that we're going to have. And narinig nyo siguro kanina in the introduction that we are going to talk about what they didn't tell you about HIV testing. And I'm so happy and honored to be first of all, with two beautiful women who are alternately wearing white and red and white. This is a great time for me today. Doctora, please do the honors of introducing again our guest.
Yes. So this is our guest for today who will talk about HIV and then updates and of course the new trends now of what is happening on our HIV testing in the Philippines. And I would like to welcome Dr. Rosario Jessica F. Tactacan-Abrenica to talk about the HIV testing in the Philippines and the things that are not being told about HIV.
Yep.
Yeah.
Welcome, Doctora Abrenica. Welcome to the show.
Thank you for inviting me over.
Yes. Thank you so much also for being with us. So let's go straight to our topic for today.
Then I just want to tell everyone that even if you're not a doctor, like I'm the only one who's not a doctor in this conversation right now. I'm going to gain a lot of information and knowledge because of the conversation that we're having. They're not going to be highfalutin and technical. I'm pretty sure you won't be because I will definitely be confused if you are. And
Pangmasa po ito.
Yes.
Taglish.
Yes.
Iyon, opo. Sige po, let's start with your
All right,
question.
Doctora, I know you are very much expert on this. Would you tell us what is now the HIV prevalence in the Philippines?
Okay. So, what is the prevalence that you know of?
The prevalence of our HIV status in the Philippines, the newly diagnosed cases of HIV. So what is now the status?
I would like to brief you about the worldwide status.
Worldwide muna.
Yes,
Okay.
worldwide muna. Global
Sige,
muna
sige.
tayo.
Global muna,
Sige.
bago tayo
Zoom
magpunta
out
sa...
muna bago mag-zoom
Bago
in.
magpunta
Okay.
sa Philippines. So,
Yes.
39.9 million people living with HIV in 2023. So, 630,000 dies of AIDS-related diseases and 1.3 million newly infected with HIV in 2023. So that just shows na mataas pa rin.
Yes.
Okay.
Yes, okay.
So we go now to the Philippines. So in the Philippines, there were newly infected with HIV 26,700 cases. And there's a projected annual new HIV infection from 2023 to 2030. Talagang tumataas talaga siya. If you try to compare it from 2022 to 2024, this is the projected, 24,400 and 28,900 respectively. There's an increase in 418% annual new infections between 2010, which is 4,700, and 2022, 24,400. So there's a rapid increase.
Oh, from 4,000 to 22,000 plus. Oh,
Yes.
that's quite huge.
Yes.
Okay.
But if you try to take a look, there are two ways on which you are seeing this in a new light. One is more people are now accessing treatment or
Testing.
diagnosis or testing.
Yeah.
Or talagang mataas talaga and we are not able to reach the population that we intend to reach.
Okay.
Okay. So, as we can see from this, HIV profile of the Philippines, the cases, newly diagnosed HIV cases per year from 1984 to August 2024, which is very recent. I just got this from the National Epidemiology Bureau. It's 138,303.
Wow. From 22,000 that you have just
So
mentioned.
over the
right?
course of 40
Yo.
years.
Yeah.
Yes.
Correct.
Kasi ang taas na talaga niya. Because when I was just starting, because I started HIV care in the late 1990s.
Oh, medyo matagal na yun.
Talagang matagal na siya. So I have seen people dying because during the time that I was assigned at San Lazaro Hospital HIV department, there were no antiretrovirals to speak of. We only give treatment for opportunistic infections. So, ganun yung naging trend na parang yung mga pasyente, parang death sentence na sa kanila yon. But we were telling them, no, there's still treatment. There's no cure. I have to be specific on that. So, wala pong lunas, pero meron po tayong ginagawang gamutan para yung virus sa katawan ay bababa para hindi na magkakaroon ng mga ibang opportunistic infection na tinatawag, kagaya po ng TB, pulmonya, mga
pneumonia.
CMV, napakadami po yan. Ang CMV retinitis can lead to blindness, may mga ganun
Mga fungal
po
infections.
So these are
mga
the
fungal
opportunistic
infections.
illnesses
Opo,
that might
opportunistic
come.
infections.
Okay,
Pero
infections.
ito po, nakikita lang sila pag ang CD4 count ay sobrang baba. So, it's 200 and below. Kasi in normal, mataas eh. It can even reach to thousands in a normal person. But for those with HIV, pag 200 and below na, talagang bagsak na talaga yung ng tao. Paano kung 50? I have seen a case na zero pala siya. Naglalakad
Zero na.
pa.
Zero
Zero na.
Okay.
Pero, okay pa siya, lumalaban, pero the patient expired kalaunan. Kasi there were all sorts of opportunistic infections that we've seen. So, we have to manage that. Pero ang nangyari, talagang late na kasi namin siya nakuha. Which boils down to the testing. Na
Okay.
dapat maagang nagpapatest ang mga tao para sila ay mabigyan ng karampatang management.
Yeah. Why do you think it's still a challenge on us to have this HIV testing, although, it's already accessible to some?
Stigma plays a role. And the acceptance.
Yeah.
No, because there are disclosure issues that you need to contend with.
Right.
Kasi yung disclosure, kailangan tanggap niya sa sarili niya. Yun yung pinakauna. The first barrier is yung sa sarili.
Okay.
Kasi kung feeling niya, wala siyang ginagawang masama at hindi siya magkakaroon yan o sobrang lakas ng kanyang naturalesa, hindi siya magkakasakit, hindi talaga yan magpapatest. Filipino culture, kailan tayo pumupunta para magpa-doktor?
Pag may sakit
Pag may
na.
sakit na.
Pag may sakit at halos gumagapang na. Diba? Yun
That's
na yung pangit sa ating mga Pilipino din eh. I don't know kung tayo lang ba exclusively or sa ibang lahi ganyan din.
Pero kasi ako, doktora, I grew up in a generation that saw AIDS emerge in the early 80s.
Yes.
And it was so shrouded in mystery
Yes.
that everyone was so afraid of it, and more so for people who are allegedly infected by it or they perceive or feel that they are. Sila siguro yung mga taong ayaw magpa-test because of,
Yes.
as you said, the stigma. No? So yung binanggit niyo pong statistics kanina from 1984 to 2024, over the course of 40 years. 138,000.
138,303.
Yeah, so that is the problem, no? Yung stigma ng mga individuals who are really have this resistance or accepting themselves that they are high risk
Yes.
individuals to have them being tested for HIV. So how do we encourage these people who are at risk? No, alam
Okay.
na natin kung ano yung at risk.
And
Pag sexually
related
at
to your
risk.
question, Doctora, have we as a nation or a culture shredded off that stigma?
Not yet.
Not yet.
Not
So,
We
yet.
still have a long way to go. From
Okay.
what I've seen for the past years, kasi during the time
Despite the fact that we have already increased the number of HIV, meaning to say yung access nila and they come out to do the testing, kaya
may
tumataas
stigma
yung...
pa din.
May
Yes.
stigma pa rin.
meron pa din. Meron pa rin. Kaya sinasabi nga namin, what went wrong? Ano bang hindi pa natin nagawa? So, we are at a loss also. So, we have done other means na ano ba kaya pwede natin? Siguro, we need to talk to these people. Yung ano ba yung ma-identified
Yeah,
namin na...
let's find out the reasons, no? Kung bakit.
Kaya nga pati nga yung mga MSM, di ba? We already went into clans. Yung mga, kasi meron silang sariling grupo.
Yeah.
Ano po yung MSM?
Males having sex with males
Male
po.
sex with-
Yes.
Because with the infection that we have here in the Philippines, sa HIV profile, there was a point in time when it was still early, mga late 80s pa, 90s, mga ang wave nito ay mga sex workers.
Yes,
That's
before.
why-
That was
yes,
before. Yeah.
That's why we had the surveillance being done near the US bases. Okay. Doon
Okay.
po tayo nag-umpisa na mag-surveillance doon sa mga nightclub patawag nila doon eh. May mga ganon.
Mga
The red
red
districts,
district.
yeah.
Mga red light district ng mga
Red light district.
may mga ganon. Dati nga meron din dito sa Manila but
Yes,
it
we
was
did.
closed,
Yeah.
diba? So, and then there was a wave. Kasi na-witness ko na to. Kasi I've been with them for quite some time na to, HIV program. So, nakita ko yung wave. Ang sumunod naman mga OFWs. Yan, nagkaroon din ng stigma yung mga OFW na, ay nako, OFW siguro yan, kaya ganyan, kung ano-anong mga pinagsasabi nila. Lalo na yung mga seafarers, kawawa naman sila because not all of them have that.
Yes, and they are being tagged,
Yes,
no?
they're being tagged.
Oh, yeah.
Di
To
ba?
have,
When you
this
were already
HIV
with
infection.
SACL, di ba? Alam mo na yung mga goings in and out dyan sa mga yan. And then, nung natapos naman itong mga OFW, ayan na yan. Mga young urban professionals na. Kaya, hindi mo pwedeng sabihin ang mga nagkakaroon lang ng HIV ay yung mga walang pinag-aralan. Kasi that was before the perceptions of people. Na, sex worker to, siguro walang pinag-aralan, kaya ito lang, kaya hindi niya alam. Nahawa siya dahil ito, wala siyang alam how to protect herself. Kasi during the time na ang wave pa ng OFW, sex workers, naturuan din yung mga girls on how to protect themselves by using the condom, no? And not only that, using the mouth to put the condom. Kasi there
Okay.
are customers who don't like to use condoms. Kaya ang nangyayari, na-expose sila both. the client and the sex worker.
And that is also the time when we started to promote
Yes.
using the condoms for the HIV, no? Or any sexually transmitted infections.
Yes.
So speaking of using these condoms, I don't know for those people, but we have to talk about this because this is a public health concern.
Yes.
Okay.
It is.
So in the context of using these condoms, how would you say, since, as we are promoting in the Department of Health of using this condom to prevent the spread of STDs, no? Since, as you mentioned, hindi yan nakaugalian at hindi lahat acceptable, no? But in the context of religion, because not all of us accept the use of condom.
Okay.
So, how would you take on that? Paano, what's your take on that? Sa paggamit lang ng condom.
Okay. Kasi we cannot ram down their throats kung ano yung gusto natin, di ba? So we have also partnership with how do you call it? Religious organizations. And they're very much
Are they supportive on
helpful.
this?
Yes.
Okay.
But
In the
they-
context of sexually prevention of the STIs.
HIV.
Yes, and HIV as well.
HIV.
Okay.
Kasi sa STI, siyempre, give it to them. Kasi yung C na ginagamit natin for condom use, they have replaced it into conscience. Pero ako naman,
So from
Ewan ko yung
tangible
mga
to
iba.
intangible.
oo, sa kanila, yun yung gusto nila. So, hindi ko sila pwedeng pilitin.
Okay.
What we can do na, but they are more accepting na. In fact, they are now inviting us to conduct lectures about HIV. So, ano yan, parang dinidiscuss ko pa rin siya, pahapyaw na nga lang. Kasi, I'm a product also of a religious, Diyos ko, yung mga Catholic
Yes.
university.
Okay.
So, syempre, kahit magmula nung high school, college, ganyan. So, syempre, may mga nakaugalian talaga na hindi mo siya pwedeng baliin. Pero, yung Pope natin, meron na rin siyang sinasabi
Yes.
about
Yes.
condoms.
There's an encyclical about it, I think.
Yes.
Yes.
So, hindi mo naman totally sabihin na hindi siya talaga acceptable for all.
Yeah,
Meron
that is
lang
right.
siguro din, nagpo-promote, pero hindi nga lang talaga yung palasak. So, ang sa atin naman, nirirespeto natin ang bawat pananaw
Yes.
ng bawat kultura,
Yung
bawat
mga preferences
grupo,
na
mga
sinasabi.
preferences. So, ganun, hindi naman namin yan pinipilit.
Doktora, yung ano naman, let's go into that. We are in the prevention.
Yes.
Now, how could we encourage people to go into the testing? Okay? Make them feel more comfortable as we approach them.
Okay.
So ano yung pwede ninyong masabi na anong paraan para ma-encourage natin sila
Ayan.
to do the testing?
Kasi sa amin, kasi treatment and care support, center, ang ginagawa namin is we tell them that there's treatment available and it's free of charge.
Okay.
So,
Free of charge.
yes,
First
it's
one to
free of
leave.
charge.
Yeah.
That's
But
good.
before I discuss that, I would just like you to know about the 95 target.
What is that 95, 95?
Okay.
95
Tatlong
targets.
95.
Tatlong 95.
95.
Ano yun? Oh,
The
yan.
first 95 is that the people who have HIV should know their status. 95% of them should know their status.
Okay.
Kasi meron naman kasi HIV na siya, hindi niya alam na HIV siya. So, dapat alam niya yung status niya.
Yung wala siyang kaalam-alam.
Oo,
na
wala
siya
siya kaalam-alam. So, paano niya malalaman na siya ay positive?
And that is where the testing
Yes.
should come from.
That's where the testing comes in.
Okay.
So, ito yung pwede din natin tutukan. And then, the second 95 is about the treatment. No? That 95% of those diagnosed should be on treatment.
Okay. Kaya pala na, this 95 is being set by the WHO?
Yes.
Yes, okay.
Okay.
Alright.
And the last 95 is those who have been on treatment should be undetectable. 95% should be undetectable sa viral copies.
Okay.
So, kasi kung they are on treatment, dapat patatesting din sila kung is the management effective? Okay ba siya? Bumababa ba ang kanyang Kasi ang goal natin is to make them undetectable para mababawasan yung opportunistic infections.
Infection.
Wala na
Okay.
tayong nakikita.
Okay.
So that will make us manage them at an earlier stage. Kasi pag maaga ang testing mo, maaga mo siyang
Maaga pa.
bibigyan ng treatment options.
Yes.
Tsaka, hindi na siya pupunta pa sa mahal ang mga gamot na opportunistic infection. So, doon na siya mag-stop na siya
Okay.
sa may
Yes.
ARV.
Yeah.
Okay.
So for the public to understand, we have presented data in the screen for you to
Yeah, it's being shown
understand.
on the screen,
This one,
yes.
It's already being shown on the screen. This 95, 95, 95 is set by the WHO
The
goals.
World
on-
Health Organization.
Yes, the World Health Organization on prevention of HIV goals, right?
Okay, but we need to close the gaps because we haven't achieved that. Although ang target kasi is by 2030. So, ilang taon na lang
Six.
natira.
Sa status
6 years
ng
to go.
Philippines, Doktora, ano
Oh
na
my
ba?
gosh. Status ng Pilipinas, medyo malayo pa tayo.
Okay.
Kasi we have only attained 59% for the first one.
Okay, so we're talking about the 138,000 plus.
Yes.
Okay? So ano lang yung
Ngayon,
status niyan? Mas hindi pa natin na-reach yung 95%.
Hindi pa. Kaya lang kasi projection ang ginagamit natin, hindi yung
Okay.
actual.
Okay, okay.
Kasi ang projection, mas mataas kaysa
Yes.
sa
Sa
actual.
actual,
Diba?
yes, of
Siyempre,
course,
it's a
yeah.
projection. So, ito namang on treatment, we only achieve 66%. So,
And
mababa pa rin.
sa treatment yan. And these treatment are being funded as a free to the recipients
Yes.
and funded by the government?
Yes.
Okay.
It's being given by the Department of Health. Although the Global Fund has been instrumental in bringing the treatment here. Kasi wala naman ng manufacture sa Pilipinas. So this is internationally procured, WHO pre-qualified antiretrovirals.
Antiretrovirals.
Yeah, ito po yung
ARV.
tawag, ARV ang tinatawag namin dyan sa mga yan. So this is being given on a monthly basis, although those are unstable condition, we can give as much as 3 months supply.
3 months supply. And
Okay.
after 3 months, how would they
Mag-refill
sustain?
sila. Pupunta sila ulit sa treatment hub.
And who will support that after 3 months?
No. It will be continuous.
Continuous.
Continuous
Okay.
support as long as the government will give. But syempre, we have to set up something, di ba? So we have set up the OHAT fund, so to speak, which is the outpatient HIV and AIDS treatment package.
Oh,
It's with
so what is
PhilHealth.
that?
So we set
Okay.
down for that kasi I'm a member also of the TWG Technical Working Group of the DOH STI HIV. So umupo kami para pag-usapan anong gagawin natin in case wala na magbigay.
Oo.
So we need to set up a special fund for them para gamitin natin PhilHealth. But of course, they have to be members of PhilHealth and they have to comply with the submission. Kasi quarterly basis.
Doctora, other than PhilHealth, you mentioned kung wala nang magbigay or kung may nagbibigay, are you pertaining to private institutions or individuals that are donating to this cause?
Kaya ang problema kasi dyan sa ganyan, hindi constant, hindi continuous binibigay nila.
Yeah.
Kasi the ARV itself is
Oo.
expensive,
It's
right?
expensive eh.
Yeah. So it has to
Okay.
be institutionals.
Yes.
Okay.
Kasi yung mga ano na lang, incidentals na lang yun or complementary na lang sila.
Like philanthropic work for people.
Yes,
then.
yes.
Oh.
They have.
Okay.
They are donating some medications but not ARVs. Kasi you need to have a special permit
And
for
the
that.
problem is the constancy and
Yes.
frequency also.
Okay.
Oo, kasi kailangan talaga na
Alright.
meron. Kaya, ang ginagawa namin dito, di ba kung ano yung, pagka okay ka na, na-approve na ng PhilHealth na pwede kang mag-avail, kasi kailangan nakaset up yan. Ayusin namin. Kaya ang, is, pagka umokay yung membership mo, okay yung availment mo, so pwede ka na. So we give the medications, the diagnostics free of charge. Diagnostics kasi medyo mahal pagka minomonitor mo na sila.
Syempre,
Like the
kasama yung
CD4 and the
CD4.
viral load.
Yes.
Kasi kailangan, ang CD4 po ay ginagawa yan para ma-measure yung panlaban ng katawan sa infection.
CD4.
CD4.
CD4 is
Cluster
an
cell-cluster differentiation.
yes.
Okay.
CD4 is an antibody.
Yes.
Minention din ni Doktora
Fight
kanina
against-
when we were still having the chat before we did the take that self-diagnosis is not really encouraged. Can you tell us something more about that? Because you mentioned diagnosis.
Okay.
Yes.
You are you talking about self-testing?
Self-testing,
Yes,
yes.
self-testing.
Okay.
Self-testing.
Kasi ang self-testing is one of the thrust that they are now promoting. Okay. Kaya lang medyo hinay-hinay lang. Kaya hindi 100% na sinasabi ko, maganda ang self-testing. Kasi it's not applicable to all. Because there are some people who I think na hindi pa ready, tapos bigla silang nag-self-test nila, and then hindi nila matanggap yung result. Yung pala, mali yung interpretation. Okay.
So, psychological profile
Psychological profile ng tao. Is the client psychologically ready for such? Of course, yung iba naman na ready, I don't have any qualms in promoting that.
Yes. Okay.
Pero dun sa mga hindi masyadong ready,
May risk.
may risk.
Oo.
Hindi ko
Unlike-
sinasabing
unlike-
outright
oo.
na hindi
Unlike
siya
for the-
pwede.
Yeah.
It can
Unlike for
be.
the routine testing that we go into the facility, they do the pre and post counseling when they receive the result of the HIV test, right?
Yes.
So structured siya.
Structured siya.
Pag self-testing, iba naman 'yon kasi may impact.
Yes, may impact siya. But
okay.
we have to remember that we have the AIDS law.
Okay.
Previously, it was called RA 8504 and then they have revised it into 11166. Ito yung sa treatment. Ito yung mga pills na take nila previously. And then, the pill burden is so great, kaya yung ibang pasyente umaayaw na. Hindi nila kinakaya. So, they might as well not have themselves be tested kasi nakita nila yung klase ng gamot na kailangan nilang i-take pag sila ay nagkaroon. Kasi dati, ito, ang tinitake nilang gamot, mamimili ka ng isa sa blue, isa sa yellow, isa sa green. So, paano kung ano yung napili mo? And that's only the daily pill burden. Okay. Kung ang last one napili mo, two tablets. And then, ang pinili mo ito, yung last one din dyan sa yellow, 2, 4, 6. 6 plus 2, 8 na. Paano kung pinili mo, ito yung last din dyan. Sa 20 plus yan. So, yun ang dami ng tinitake araw-araw. But then, we now have the antiretrovirals, which is a fixed dose combination.
Wow.
So, parang 3-in-1 na siya. So, isa na lang pill ang iinumin mo sa bawat araw. So, ito rin, I think it's also one come-on for people to be tested.
Yes.
Kasi hindi na doon kapangit, pag ikaw ay na-diagnose, mamatay ka na kaagad. Mga ganun kasi yung
Yan yung
iniisip
perception nila.
diba?
Oo.
That's the perception.
So, nung panahon, but say 40 years, 30 years back, what was the perception? I get
Yes.
I get diagnosed and mag-positive. It
Wala na,
gets to
mag-antay
my
ka na
psyche,
lang.
parang
Yes.
wala na, ito na. Just counting the time. To expire na ako. But hindi pala.
Yeah.
Once you get tested, there are options for treatment.
Yes.
And in spite of that, no, kasi sabi niyo po, yung numbers natin are not climbing up to 95 yet. It's still on 59
Yeah.
on a projected basis. What are the barriers despite the fact that there are already plenty of testing, rapid testing at that is available? Ano
Yes.
yung pumipigil sa kanila na other than religion or the stigmas, no? What else?
Actually, napapuzzle din kami. Kasi, what went wrong? Kasi sa DOH, nag-uusap kami, ay, ano ba yan? Ano bang nangyari? Ano bang hindi pa natin nagawa? What more can we do to be able to access these groups? Kasi baka naman mamaya kulang pa tayo ng information, kulang pa tayo ng ganito. Kaya ang ginagawa din namin, in the hospital per se, I conduct stigma reduction trainings.
And how is that?
Stigma reduction, hindi yung mga healthcare workers ang ginagawan ko ng ganyan, kundi mga security guard, janitorial, admin. Kasi if a person would like to access care in a facility, who is the first person that they could meet? magpapatesting siya.
Just an ordinary person.
Just an
no?
ordinary person. Pupunta siya. Sir, saan po ba yung patesting? Magpapatesting sana ako. Kung hindi alam ng security guard yun, hindi niya alam yung mga services meron ng ospital, saan niya ituturo? Kasi pag sabihin niya, ay sa laboratory, pumunta ka lang. Hindi naman ganun kadali yun. Kasi ang laboratory is a big laboratory.
So in short, you are empowering your staff or your employee in the hospitals that they should know the protocol.
Yes.
Okay.
And
That's
know the
also a
services available.
Yes.
Is that where community-based testing starts?
Iba din
Can you
po
mention
yun.
that? Iba pa
Yung
yun.
community-based testing.
Iba pa.
Magkakaiba yun.
Yes,
Kasi ang community-based testing, ang pumapapel dyan is ng mga prevention sites. They go to the community and they offer.
Okay.
Offer pa rin
And who are this? Are this the is the
mga organizations.
private organizations?
Some of them.
Okay.
Yes.
Can you name some of them?
Ang ano dyan, yung mga TLY, mga ganon. Tapos yung mga PAFI,
Okay.
Pinoy Plus organization, yung mga ganon.
Pinoy Plus is still existing,
Yes, it's
right?
still existing.
Okay.
That's the
And,
first
meron pa yung
HIV
sinasabi na
organization.
love thyself?
Love yourself.
Love yourself.
The Love Yourself, TLY.
It's an
TLY.
organization.
It's an organization. They go strong on prevention. Although
So they
have
go
now
to the
begun-
community and offer this testing.
Yes. Meron kasi, yung sa Global Fund, yung Filipinas Shell ngayon, yung recipient, they organized community-based testing. Meron silang mga, parang dinedesignate na mga facilities or even the region also can do that.
Okay.
Kasi syempre, hindi naman, yung DOH kasi it's a big organization, tapos merong, may RESO, may regional, may ganyan,
yes.
may mga local hanggang doon. So, mga, kumbaga, pag titignan mo talaga, ano pa ba kulang natin? Kasi ang dami
yes.
Ang dami na nating nagawa kung tutusin,
Yeah.
di ba?
And you have just also mentioned that the treatment's also being simplified, right?
Yes.
Yes. So,
I think it's a big come on for them to come for testing.
yeah. So, I think what we want to learn also when it comes to community-based testing, do you think this will also lessen the stigma?
Yes, I think so.
Because
But
it's
you
more
can-
accessible.
Yes.
Yes, and you cannot just do community-based testing without conducting yung mga sessions. Halimbawa,
They do the pre-counseling.
Alin?
Yung community-based testing,
Some of them do.
they do the pre and post counseling.
Yes, some of them do because
okay.
it's a requirement of the law. You cannot do testing without counseling. Kailangan talaga siya.
Okay.
Unlike your typical get your blood pressure or get your CBC.
You
This is
cannot
different.
Yes,
Okay.
Yes.
it's different. Kasi if you talk about that, naku, nagbe-break ka ng law, paano kung may magsumbong, di kulong ka because there are
Yes,
penalties.
Merong
that you have to
kasing
incur.
issue dyan na dati kasi we do have our healthcare workers or the medical technologists do the testing, right? And they undergo proficiency training
Yes.
just to do the testing, help empower them with the pre-counseling with the help of the
Yes.
physician and do the post-counseling.
Yes.
But in community-based testing ba, Doktora? Ganun din po ba?
Meron kasing mga na-train din doon.
Okay.
Hindi ko lang alam kasi hindi pa ako naka-attend ng community-based. Kasi syempre iba naman ang turf nun.
Yeah.
'Di ba? So hindi ko pwede sabihin na hindi nila ginagawa
So,
to.
yung mga
Oo,
tinetest
hindi.
nila, Doktora, saan napupunta yung mga datos na to?
Napupunta naman kasi pinapadala
Sa
naman dyan
sa DOH din nila
DOH
din.
din.
Okay.
Kasi they need to report. And paano pag nag-positive, they need it to be confirmed. So they send it to RIVDA sites na.
RIVDA.
Oo.
Sa
RIVDA
RIVDA site.
is-
Oo,
The
RIVDA
Rapid
sites na.
HIV Diagnostic Algorithm.
Okay. Which
Rapid,
which is what does what's the
Yun po-
importance of
Yeah,
RIVDA?
the importance of
and
RIVDA. Can you
significance?
explain it to the
Okay.
public? What is that for?
Before, we used to do the confirmatory testing, which is the Western blot. And it takes a lot of time. It's a long
blot,
time
yeah.
for it to be released. So, itong RIVDA kasi mas mabilis na siya.
Because it's being decentralized or bring down to the regions.
Yes.
Yes. Okay.
Diba? Meron na sila mga RIVDA sites, nag-expand na nag-expand. Just like what we did with the treatment hubs. There were only original 3.
Okay.
Diba? PGH, RITM, San Lazaro. Ang PGH is under the department, under the office of the president, but whatever the DOH has, we give it to them. Ang RITM at San Lazaro, under the Department of Health, but we have different mandates. RITM is more of the research and San Lazaro is more of service.
Yes.
So, tatlong magkakaiba yan. So, what we did was when the Global Fund was approved the first round, nagtayo kami ulit ng 3 more sites. One from Luzon, one with Visayas, one from Mindanao. And then the other Global Fund approved ulit, nagtayo kami yung other 5 sites. No? So, ito yun yung mga nag-expand. But we were also the ones who instituted them. Kasi kami yung nag-training, pumupunta kami kung saan-saan ni Dr. Ditang, kasi ani ang kapartner ko during the time. Alam mo yan, Bing.
Yes.
So now, we have more than 1,000. So ito, yung nasa screen, is yung HIV/AIDS Registry of the Philippines, wherein there are DOH-certified RIVDA confirmatory labs and designated HIV treatment hubs and primary care facilities.
So we have this RIVDA to make it more accessible and to get the results right away, right?
Yes.
Now, having been said that the RIVDA really make it more accessible to our people who wanted to have this voluntary testing and even the community-based testing going to the RIVDA sites.
Yes.
Okay? And these RIVDA sites, do they also have this treatment hub once they are being accredited and have this access for testing? Meron din ba silang treatment hub?
Not all of them have treatment hubs, not sila lang.
But that's part
they
of
can.
consultation, I think, Doctora. When they say positive, so my options would be treatment already. They would
can
be
be
given.
linked to care.
Okay.
Tawag
That's part of
namin
the
doon, link to
consultation.
care.
Link to
Link
care.
to
Link to
care.
care.
But it doesn't necessary that a hospital is a RIVDA site. Hindi siya, wala
Hindi
doon
siya
yung treatment.
automatic. It's different.
It's different.
You can be accredited for the RIVDA, but not as a treatment hub.
Okay.
So maganda
okay.
kasi
So malinaw yun.
accredited ka as RIVDA and as treatment hub. Kasi San Lazaro ganun. Meron kaming separate na para kaming meron lisensya, so to speak, effectivity ng
link to care. So we call it link to care.
We
Link
call
to
it
care.
link to care. And link to care is not necessarily starting with ARV. It can be for other things, di ba? Na baka anong kailangan niya, di ba? Meron pa ba ibang opportunistic infection to? Like may TB ba to? So, kanino na may refer pag may TB? O
Yeah.
sa TB dots.
TB dots.
Ayan,
okay.
di ba may mga programa kasi yan
But
na
for
TB
every
program.
region has this?
Yes.
Okay.
So
Luzon, Visayas, and Mindanao.
Yeah.
Okay.
So they can refer patients to them. Depende sa need.
Okay.
Could it be that part of the stigma is that when they get tested and they say, for example, they anticipate, I'm positive, there will be a host of possible infections that I'm vulnerable to. That's why, wag na. Parang ganun yung mga
Yung iba gusto
ugali
mamatay na lang, mag-antay ng kamatayan. But we have been trying to correct that mindset.
Yes.
Kasi
Yeah.
kung may TB ka, pwede mo pang hawaan yung mga pamilya mo. At hindi lang yan, mauna ka pa kung may HIV ka din. Kasi
Yeah.
double whammy yan eh.
That's right. Baba
TB,
na yun.
HIV, because we have a program for that also.
Okay, Doktora, I can see all the efforts of the DOH and also your programs. No, I know you are supporting on this. Since we have a lot of HIV patients or HIV diagnosed cases, and we are talking about thousands, and we have already decentralized the accessibility of testing and even the care.
Care, yes.
All right.
Yung mga pamilya mo, at hindi lang yan, mauna ka pa kung may HIV ka din. Kasi
Yeah.
double whammy yan eh.
That's right. Baba
TB,
na yun.
HIV, because we have a program for that also.
Okay, Doktora, I can see all the efforts of the DOH and also your programs. No, I know you are supporting on this. Since we have a lot of HIV patients or HIV diagnosed cases, and we are talking about thousands, and we have already decentralized the accessibility of testing and even the care.
Care, yes.
All right. do you think yung ratio ng healthcare personnel or healthcare workers would compensate the need of these hundred thousands of HIV cases?
I don't think so.
So it's
So
not
there's
about
a need.
numbers. It's not about the numbers of healthcare
Yes.
people.
Because in our facility alone, kulang pa kami.
Kulang
so we
pa.
need more.
Okay.
We have more than 3,000 cases under our care. It used to be more than 4,000.
So parang sinasabi mo, Doktora, kahit napakarami ng HIV testing kits or diagnostic tests sa Pilipinas, kung wala naman gagamit nito, parang useless din.
Oh, kasi you have to intensify the campaign.
Right. The 95,
okay. That is
95,
now why we are here.
Yes. You have to
Okay.
intensify the campaign, and I greatly appreciate what you're doing because you are reaching a lot of people by doing this.
Yes.
Diba?
Okay.
Kasi may nare-reach kami, may marireach kayo kasi kanya-kanyang clout yan eh. You have your population to reach. So, malay mo, may makuha ka dyan. Kahit nga isa lang, it matters a lot.
Yes, because it is spread by mouth.
Yes.
You know what comes to mind? Because again, I came from that generation in the 80s where we saw Magic Johnson, Irvin Johnson.
Yes.
I hope I got his name right. For sports fans, if I got his name wrong, please write us a comment on the chat box. But Irvin Johnson or Magic Johnson was diagnosed in the 80s. I think 85
Yes.
or 86. And
Bago pa lang eh.
naging issue yun na maglalaro siya sa Dream Team but he has AIDS.
May
It was a
HIV
mystery.
lang
Hindi
siya,
siya
not
pinalalaro
AIDS.
nun. Ay, hindi
Yes.
pa pala. HIV lang pala.
HIV lang siya.
Now, everyone is talking. Wala na siyang, I don't know the veracity or the truth to that.
No, he still has, pero hindi
Opo.
siya nag-progress to AIDS.
Yeah, there you go. Now,
Yes. And
which
he
brings
maintains his health.
yes, which brings us
Yes.
to the next question. Would be it says here, this is a success story.
Yes.
No, in for that larger part.
Yeah.
In this case, Doctora, could you share with us success stories where rapid HIV testing or just testing per se made a big difference in someone's life, similar to that of Irvin Johnson?
It's not a celebrity kasi yung mga pasyente ko, marami ako nakita na.
Hindi pa celebrity.
Hindi
siya
sila
celebrity.
Hindi
Ah.
sila celebrity, but common people, no?
Common people
I
pa,
have
no?
seen patients, clients, I call them clients.
Clients,
Yeah,
yeah.
Kasi
not
mas gusto
patient,
daw
oh.
nila 'yon. I have seen them na-diagnose sila earlier and they're very young. 'Di ba? Merong isa doon, may seafarer, akala niya wala na yung career niya. Pero okay naman.
Pwede pa.
Oo.
So
Kasi
there's no
all we need
discrimination,
to
no?
do is tell the employer that HIV siya, wala siyang opportunistic infection, he is undetectable, he is maintained an ARV, and it's up to you if you allow them. Basta we give them that.
So, prerogative ni employer.
Yes.
Basta may
Prerogative
clearance siya
nila.
coming
Basta-
from the
Actually, hindi namin
physician.
siya clear for HIV. It's not. Kasi there's a
fit
wrong
to work.
notion.
Yeah, the fit to work.
Actually, hindi fit to work din ang tawag namin.
Hindi din.
Ito yung condition niya. It's up to you if you allow them to work. Pero, as of clinician's perspective, ito yung ano niya. Which is okay. Basta maintain the health, maintain the ganito. Pero hindi ko siya nasabi na fit to work siya na kaya yung kahit may
Yes,
mga
yes,
mabigat
that's
na
right.
trabaho,
Yeah.
pwede siya. Kasi medyo ano na yan eh. Medyo masyado ng malawak ang mangyayari niyan.
Kasi nakita ko yan I once gave a talk to seafarers. They had this pre-PIDOS, pre-departure, PIDOS usually,
Pre-departure
Doctora, di ba?
orientation seminar. Yes.
Seminar.
Ano yun? Positive siya, ano? Yung nag-talk.
Well, yes.
Yes.
And then that's where I realized and discovered that before a seafarer is allowed to get out of the country or be fit for
Yeah.
work or as you said, just to be allowed to work,
Yes, pre-departure.
dapat meron siyang testing na pinakita. Either,
Yeah.
Hindi ko alam, akala ko naman noon, pag negative, wala na. Sorry, boy, hindi ka na pwede magtrabaho. Yung pala, pwede pa. It depends,
Yes.
depending on
So,
the decision
employer.
of the
Sa
employer.
employer.
Yeah.
oo.
Okay.
Okay.
So the stigma now, especially for our
Lessen.
seafarers
Oo.
and for that segment which is overseas Filipino workers.
So yun
Would be
yung
lessened.
gusto nating ipaliwanag sa madla ngayon. Na hindi ko mo you have this kind of HIV. I think you have to consult, no? Sa
yes.
Unang-una
proper-
sa lahat, huwag matakot sa testing.
Oo,
Oo,
wag matakot sa
wag matakot
testing.
sa
oo,
magpa-test.
because it's for
Yes.
their safety and of course, you would benefit pa nga dun sa mga access ng medicine, counseling, and monitoring of your, what do you call this, the CD4 count, right? the progress of your
Yeah.
infection.
Yes, and the treatment.
Yeah. All right.
So, di ba, may mga success stories dito, mga bata pa, and
Yes.
those that are allowed to work, na formerly akala natin di pala pwede. Now, let me ask this question, Dr. Bing. Dr. Abrenica, how can we help as private sector,
Yeah,
as
in
private
the
citizen?
industry. Yeah.
Okay, in our own little way, when we talk about HIV, so medyo wag tayong mangilabot, wag tayong mag-stigmatize. Hindi ko sinasabing normal na siya. It's not. Kasi alam naman natin, kultura natin, hindi pa rin acceptable yan, di ba?
Yeah.
But, yung mga myths and misconceptions about it,
Dami.
kahit papano,
Oo.
baka pwedeng makorek. Like, for
Yeah.
example, nakukuha sa laway, hindi po.
Laway.
Nakagat ng lamok, hindi.
In
Yung mga
the
ganun.
early 80s, they called it gay cancer.
Yeah.
Also, di ba?
Gay greed ang tawag nila yun.
Gay greed.
Gay-related immune disease.
Gay-related
Yes.
immune
Gay-related
disease.
Doon sa may
Greed.
San Francisco area.
Right.
Yun yung mga nauna.
Several
and then
movies
New
about
York.
that.
Yes.
Yeah.
There have been several movies. But one thing I commend is, are you a tennis enthusiast?
Yeah, to some degree.
Okay, to some degree. So, do you know Arthur Ashe?
Yes.
Okay,
Yes.
the first
African-American.
Yes,
Yeah.
African-American na got HIV because of operation.
Right.
Okay. So during that time kasi wala pang ganun ka structured yung mga
Right.
ginagawa.
Right.
So hindi naman testing yung mga organs, mga ganun na
That's right.
ginagawa pa noon. So I have been a recipient of his scholarship.
Wow, okay.
So, ginawa niyang centerpiece ng kanyang project is to invite healthcare workers from countries na medyo hirap ang training.
Okay.
So, kinukuha lang nila is 2 people per year, no? So, pero binigay lang sa akin kasi hindi ko alam kung makuha ka, basta applyan mo. Parang ganun lang. Sabi ko, sino ba yan? Hindi naman kasi ako nagte-tennis. So, I'm not private to, So, nung nalaman ko, sige. So, tinignan ko, oo nga, okay pala to.
Yeah.
Kasi pumanaw na siya, pero yung
Yes.
physician niya, si Dr. Murray, siya yung ginawa niyang taga-manage nung fund niya.
There's a
yung
foundation.
program.
He set up
There's
a
a
foundation
foundation.
for that.
They set up a
okay.
foundation with a wife.
Yeah.
So nag-i-invite sila, and I don't know if up to now they are still inviting medical people from all over. Pero kami yung mga nauna sa Philippines. It was
That's right.
Dr. Annie first, and then me, and then sumunod si Dr. Janice. Marami na rin.
That's great to know.
Marami na rin. And
Kasi Arthur Ashe is one of those persons that allowed us to understand it better.
yes.
We thought it was just greed or gay cancer or for the promiscuous.
Siya oo. Straight siya So, ganon, he got infected because of another reason.
Right.
And one thing that opened also my, ang ganda, kasi yung niya is 1 month lang naman yung ginawa namin doon. But it opened my eyes to so many things because I was able to visit other
That's in the
facilities.
US. In the
Yes.
US, yeah.
Maganda kasi yung base nila is New York Presbyterian Hospital and Weill
okay.
Cornell.
Cornell
Cornell
University.
Yes.
University.
So, medical college. So, nung nalaman nga ng kapatid ko nag-apply ako, natanggap ka? Hindi pa Wala naman. Baka hindi. Kasi ang dami daw nag-a-apply dyan. I don't know. Hindi nga alam ng asawa ko nag-apply ako. My golly.
And you were chosen.
Oo. Anong gagawin ko dito? Parang hindi ko na malaman kung ano.
Konti lang sila.
Oo.
Okay.
Dalawa lang talaga kami.
Dalawa lang kayo nung time na
Dalawa
yun.
lang
Yeah.
kami per year. Kasi sabi ko, hoy, anong gagawin ko dito? Hindi ko Nung sinabi ko sa kapatid kong doktor, sabi niya ko, tanggapin mo yan. Ayaw mo pa niyan, Diyos ko, Cornel yan. Ano ba? Tanggapin mo yan. Kung wala sang,
And
hindi
that
ko pa
is
nga alam
1 month
kung
training.
Yes. Hindi ko pa alam kung may allowance ba yan, kung ano ba yung bibigay niya, ganyan. Tapos, only to find out na libre airfare, libre yung accommodation, may allowance. Parang, oo nga, maganda. O, sige, go. Tapos, syempre, kailangan ko ng endorsement, pero katakot-takot naman na
Yeah.
But then, I'm encouraging other healthcare workers to do such.
And mahaba kasi yung resume, CV ni Doktora. Dapat nasama pala natin yun sa
Hindi
introduction.
hindi mo kailangan.
I don't know the foundation. Pat,
Ayan
can you
na.
help us? Can you help us research what is the
Wag
name of the
na.
foundation of Arthur Ashe? Because that's
Arthur Ashe.
Is it Arthur Ashe Foundation? So
Arthur Ashe.
Doktora Abrenica is part of one of the recipients of the Arthur Ashe
Ashe,
Foundation,
yeah.
which
Kasi
is a
yung
big
iba
thing.
din na IDS dito sa Pilipinas,
I hope
napasama na namin.
there is more
Recommended
access to
them.
that
Yes,
for the
yes.
healthcare workers.
Diyos ko, tinatry ko nga i-access ulit yung aking mentor Tatry ko ulit.
That's
Pero
nice.
yung
Good news.
mentor
no?
na may access pa ako, yung sa Japan natin.
Yeah.
Yung sa JICA, na iba naman yun. Na-infect
Yeah.
naman
Pareho
yung
kami
mga
nag-fellow
tao
ng JICA.
doon ng blood transfusion. Yun naman, blood
Okay.
transfusion. So iba
Okay.
iba yung profile ng mga tao per country kasi.
That's right.
Alright.
Oo.
That's
So it
nice.
opened my eyes to so many things.
So,
kung ano yung mga
what you're telling to us
insurance,
now,
yes.
Doctora, is to empower more and enhance our healthcare workers when it
Yes.
comes to these programs or
Yes,
advocacy.
I encourage them to
Yeah.
look for other trainings, not only from the Philippines, but also abroad.
Yeah.
Kasi lalo when they are younger, they have more opportunities.
That's right. That's right.
Kasi
And more
lalo
energy.
na yung Japan,
Yes,
meron nag-open, pero dapat less than 45 years old naman ang gusto nila. Talagang
Okay.
meron mga
Since you
ganun
mentioned
cut-off
kanina yung ratio at saka yung proportion ng mga HIV cases versus that of the healthcare unproportionate.
Yes.
Tama?
Disproportionate.
Kasi
Yeah,
we
no?
get
This one.
200 cases per day consultation only. Ilan lang yung doktor ko, ngayon lang nadagdagan. And I have to divide that.
And you're talking
between
only for
ward and
San
OPD.
Lazaro.
Your facility
I'm talking
only.
only of San Lazaro,
Lazaro.
from the facility.
Right. And
Yeah.
and if our numbers are only 59 and the target is 95, 59 is even projective
Yes.
or projection, then there's a lot. And first and foremost,
There's so
testing.
many things, yeah.
Testing.
So I think do you think our industry, for example, the IVD industry could help you more on this program?
Yes, maybe you could partner with us. And I would
Hint,
like you to be more active in the celebrations that we have for the HIV.
Kailan po?
Yeah.
Please tell us
One
about
is the
that,
World
Doctor.
AIDS Day,
World
and
AIDS
the
Day.
other one is Candlelight Memorial. Have you attended such?
Not yet.
Yes.
World
When
AIDS
is
Day
the
muna tayo,
World
Doktora.
AIDS Day,
Oh.
naka-attend ka na?
Hindi pa,
On
no
TV,
ba?
I watched it.
Okay,
But
pero
World
yun,
AIDS
medyo
That would be
masaya.
on the, anong
Opo.
araw yan?
Usually, they hold it on December 1.
December
Okay.
1st.
For the facility that I'm heading, hindi ko ginagawa ng December 1. Kasi ang daming kasabay niyan eh. Mag-aagawan kayo ng tao niyan.
Christmas
Yes.
party.
Oo. So, hindi.
And
Iba kasi,
conventions and conferences.
Yes.
Also,
Kaya nga, ang ginagawa namin is we identify a date na acceptable sa mga pasyente because actually it's for them also eh.
That's right.
Kailangan
And
kasi
the
rin
Candlelight
namin
Memorial.
Candlelight
Memorial
Memorial.
is
When is that?
May. Tapos
May siya.
na.
Tapos
May siya.
na.
We have partnered with the PNAC, the Philippine National AIDS
AIDS
Council,
Council.
Secretariat.
Okay.
So they were happy about it because nakita nila and that was the first time na nag-attend din sila ng lotus ceremony. Kasi
Ano po yung
iba-
lotus ceremony?
Lotus ceremony is, di ba, pag may namatay kasi nung araw, nagagawa silang quilt. Yes. And the
okay.
quilt, pinagduduktong-duktong nila to make it into a big one.
Okay.
So dito sa atin, meron din tayong mga ganon. Marami na rin kami, mga ilang piraso na yung meron kami. Na ito naman, pinatago namin sa National Museum and nilalabas lang namin pag kailangan na namin. Si Nenet lang ang susi dyan para ilabas
si Nenet,
namin. Nenet
Remedios.
Ortega was the former
Program
country
lead.
manager of the
Remedios.
country director of hindi, not Remedios, tapos na siya. AIDS Healthcare Foundation.
Ah,
It's a
AIDS
yes.
Healthcare
US-based,
Foundation.
Okay.
organization. Din, partner din sila. We have a MOA with them. So,
Okay.
it can help us also kasi nagbibigay sila ng treatment for opportunistic infection. They give it to us for our patients. So, we're thankful kasi marami ng mga Tapos sa government pala meron pa iba, aside from the OHAT, may malasakit din tinatawag. Malasakit, diba? Yung tinayo ni Bongo, parang
Yes,
Yes,
malasakit.
yes,
Something like
malasakit.
that.
Oo.
Pagka ubos na yung fund ng pasyente namin, baka pwede na kasi na gamit na niya lahat ng uhat niya.
Oo.
Baka naman pwede, adapt mo naman. So, I have created a team ng HIV and AIDS core team. I just don't know in other facilities, but there should be one. Disciplinary. So, may kasama dyan mga doktor, nurse, medtech, social worker, dentist, psychiatrist, binuo ko na. Para lahat niyan, pag nagpa-meeting ako, ayan, anong concern nito? Ito yung ganyan. Parang ganun. It makes life easier for all of us.
That's good. That's good. And we can tap this one, no? To
Yes.
to cooperate, to collaborate with them
Yeah.
with these programs or advocacy
Pwede naman
programs.
kayo. So,
Yeah.
we can invite you, you can attend our celebration, and
Gladly.
just see
Yeah.
what
Yes.
you would like to do. Dati, meron din akong program for the children. Meron din yung
yeah.
Rush Children's Walk. Meron din akong ginagawa. No,
Doktora, yung
staff.
mga children na may HIV din.
Meron. May
you
program ako for that.
Okay.
Yes.
And are there plenty of them?
Marami. Kasi mother-to-child transmission na
Yeah.
hindi kasi na-diagnose earlier. So, sana kung early pregnancy, na-diagnose siya, pwede kami magbigay ng ARV sa nanay.
Sa nanay,
Para
bago
hindi na niya
ipanganak.
ma-infect
That's
yung
right.
bata.
Yeah.
So, not all babies born of HIV positive mother turn out to be positive.
Okay.
There are interventions that could be made. One program of that is the Order of Malta Philippines. It's a religious
Malta.
organization.
Order of
Malta.
They have
Malta.
adopted the mother-to-child prevention.
Okay. So for
Diba?
people that for some reason do not resonate with them this particular issue, I think mother to child is something
Yes.
that would change their minds about this.
Yes.
Yeah.
And in fact, I'm actually more
Yes.
interested. Not because I'm not interested with the AIDS, HIV issue, but I think it's more resonant for most.
Yes.
Doktora, in the interest of time, I love talking to you and
Yeah.
I'm enjoying this so much.
After
Ang
this
dami,
one.
ang
Oo nga
dami
eh.
pang natututunan kay Doktora. And there will be next.
Yes.
episode,
What
right?
I'm saying is if we keep asking her, kulang po hanggang alas 10. Kasi alas 3:30 ngayon ng hapon dito sa
Your
Parañaque.
time.
No.
Doktora, we
so
find it
enjoy
very
this.
interesting and marami pong makikinabang, no, sa mga kasamahan natin dyan, mga kapwa natin Pilipino,
Oo.
yung mga kabataan, you really need to be updated on this information. And we
Doktora, on that note, your parting shot, Doktora Abrenica, on
yes.
what we just talked about and how you want people to respond to this if you want them to respond.
Okay. Kasi meron akong dito na ang gusto sana namin is those on treatment sana to keep the viral load as low as possible. Ito yung gusto namin. So, for those who are on treatment, kailangan regular yung follow-up.
Yes.
And for those who don't even know that they are positive, please get yourself tested if you have identified yourself to have risks. Hindi naman to dapat ikahiya, itago. Kailangan nyo lumabas para mabigyan natin ng solusyon.
Yes.
That's what we need and what we aim for as healthcare providers. Yun lang.
Thank
Maraming
you so much.
salamat, Doktora.
Thank you so
Doktora.
much, Doktora. So, Sir Giselle?
Well, if you have any comments and suggestions or for the show, or if you want to drop a line to Dr. Abrenica, please write us on the comment section and on the chat box, and we will make sure that we try as best as we can to respond to your questions, to your comments, as well as to whatever you want to say. On behalf of the JARC Academy Radio channel, Dr. Bing
One
and
Health.
our guest of honor today, One Health, JARC
Yes.
Academy Radio channel, Dr. Abrenica, thank you so much for your time.
Thank you, Doktora.
welcome
So
po.
much. Greatly
Salamat
appreciate
po.
po. Maraming
So,
salamat.
Para sa inyo pong lahat, dear friends, brothers and sisters, ladies and gentlemen, be useful, be kind, and be better every day.
Yes.